Hello everyone, this is Samson. I'm here to explain more about the euthanasia process in dogs. So euthanasia is a humane and compassionate procedure that is performed to end the pet's life. So in IBCM, we euthanize a dog if the dog is showing rabies signs, or if the dog has been exposed and there's no history of vaccination. The dog's supposed to be euthanized. So euthanasia happens in 4 steps. The first one, we call it pre-euthanasia discussion. In this process, we talk to the pet owner. We discuss why are we gonna euthanize the dog. The owner is supposed to give a consent. He or she is supposed to accept our proposal that we are euthanizing the dog. So the second procedure, we call it sedation. So sedation is the process which helps to relax the dog and also avoid stress or anxiety. So during sedation, we use sedative drugs or tranquilizers. For example, we can use meditomidine or the combination of both meditomidine and this one intramuscular. And it takes us to see the effect. This is the sedative drug. It's a meditomidine. So since we are euthanizing the dog, we just go for the higher dose. So in this case, I can just go for 1 ml of meditomidine. Then we change the needle. Then we go and sedate the dog using IM. So you can go on the neck, on the thigh, wherever you feel like you have enough muscles. So in this case, I'm using the thigh to sedate, and it should be M. Okay, so we just have to wait for a few minutes for us to see the effect of the sedation. The dog's gonna get relaxed, gonna be calm to avoid stress or anxiety. So in the process of waiting, I can start preparing the induction for the dog. So before I talk about induction, after sedating the dog, the next step is to put an IV catheter. So we use the back leg for the safety reasons and use the saphenous vein. So when the dog is sedated, when the dog is calm, the next step is to put an IV catheter using the back leg for the safety reasons. Okay, so you can see the dog is now calm, good to go with the placement of the catheter. So we go for the back leg, and you suppose clip the area or you shave. I'm lucky because I'm using this clipper, but sometimes you can just use a blade, in the field. So clip the leg, expose the vein, make sure the vein is visible. I'm gonna use my colleague just to help to raise the vein for me. Right. So before you put the catheter, make sure you're able to see the vein nicely. In this case, this is my saphenous vein. That means I'm good to with my catheter. So I'm using my finger just to stabilize the vein. Once I see the blood is coming here, so I start advancing the stylet while taking the needle out. Yeah, the blood is coming. Now close. See, my catheter has been stabilized now with the tape. Then next step is to induce the dog. So in the process of induction, we use ketamine, and so just go for higher doses. So this process of induction result into rapid unconsciousness. Just make the dog unconscious and aware of what is happening around the environment. So now I'm gonna prepare my induction, combination of both ketamine and diazepam. Okay, so this is my ketamine and this is my diazepam. So I'm gonna draw almost 1.5 mils of ketamine, and also take almost 1.5 mil of diazepam, like a 1-to-1 ratio. Right. So in this case, I'm having almost 3 mils of induction. That is the combination of both ketamine and diazepam. You can pause. Yeah. Now I'm gonna induce the dog. So just have to wait for a few minutes for the dog to go unconscious and aware of what is happening around the environment. We are now going into the the final step, which is the administration of the euthanasia agent. Euthanizing now. Normally we use the agent known as potassium chloride. This one is our euthanasia agent we use. This agent goes straight to the heart and it causes the cardiac arrest, or it makes the heart stop. So this is the final agent we use for euthanasia, potassium chloride. So I'm about to give almost 10 to 15 mils of this euthanasia agent. Now the dog is unconscious. That means I can proceed with the administration of the euthanasia agent, which is potassium chloride. So I'm going to use the same catheter. So this one goes straight to the heart, causing the heart to stop beating, pumping blood. That means the end of life for the dog. And sometimes you see the dog start, yeah? That is a clear indication that the dog is dying. Can you see? Now the dog is gasping. So just have to wait for some few minutes while checking the pulse and check the breathing for the dog. It's only that I don't have a stethoscope, just to check, just to listen to the heart. But when you have the stethoscope, you just have to listen to the heart, feel the pulse rate, check the breathing rate for you to be sure if the dog is dead. But with me, I can't see the breathing, so let me try to feel the pulse. So this dog cannot feel any pulse from the back leg itself. It's a clear indication that the dog almost dead. Pause. So in summary, euthanasia starts with pre-euthanasia process. Talk to the pet owner, get consent, then go for sedation, use sedatives or tranquilizers. You can use metomidine or the combination of both metomidine and butyfenol. After that, wait for a few minutes, then put an IV catheter, especially on the back leg for safety reasons. After putting the IV catheter, then you induce the dog to make the dog unconscious or unaware of what is happening in the environment. After inducing the dog, then you can euthanize using the euthanasia agent. In this case, we have used potassium chloride as our euthanasia agent. After euthanizing the dog, wait for a few minutes, check for the pulse, the breathing. It's a clear indication that the dog is dying. Thank you so much.